Good afternoon, Mayor, councilors, and staff. My name is Yoli Diaz. I will send each of you an email with a proposal asking the City of Las Cruces to establish medical health care as an essential community investment through a joint powers agreement, a JPA, with Doña Ana County. Also, I accessed case documents of the lawsuit of City of Las Cruces and Doña Ana County versus MMC. If I interpret these correctly, the judge has dismissed Apollo Global Management from the lawsuit, not a surprise, and I understand that the city and county have informed the federal court that the parties are attempting to resolve the MMC litigation before engaging in lengthy litigation. Whether that litigation ultimately settles or proceeds through the courts is, of course, a legal matter. However, I believe this moment also presents an additional opportunity. The City of Las Cruces will have two avenues to fund medically necessary health care. One is the Telshore Facility Fund that last week's presentation included the expectation of $1.2 to $1.5 million of yearly investment proceeds. I understand that no funding is earmarked for medically necessary health care, nor medically necessary diagnostics which are essential to the proper diagnosis of patients that are decided by medical providers, not government officials. These proceeds can continue to fund $600,000 to the nonprofit organizations that have been served yearly, and $500,000 can go to the fund medically necessary health care. I am also addressing the anti-donation clause in my email that allows state, counties, and municipalities to provide a provision for the care and maintenance of sick and indigent persons. Further, if the litigation results in a financial recovery for the city, I respectfully ask you to consider preserving those proceeds as a permanent investment similar to the Telshore Facility Fund written into the settlement that will be dedicated to funding access to medically necessary care only. This will benefit the people of our community in perpetuity by utilizing the proceeds yearly. It should also be considered through a JPA with Doña Ana County, putting the monies together if legally possible. The principal can remain intact while the annual investment earnings provide a sustainable source in perpetuity funding for medical health care through the JPA. My proposal is not intended to revisit the past for its own sake. It is offered in the hope that the lessons of the past can help guide future decisions. I believe healthcare deserves to be recognized as one of the city's essential community investments alongside parks, housing, and economic development. I also believe the residents of Las Cruces deserve to know where each of their elected representatives stands on this proposal. One last thing. I recognize that no healthcare assistance program can meet every need. No community organization, not a food bank, not a homeless shelter, not a domestic violence program can honestly promise to help everyone. Funding is finite. What communities generally expect is something different. They will help as many people as they can with the resources available until the next funding year. Thank you. And I've got some documentation for you.